You said there are a number of reasons to vaccinate children, and I think a lot of parents are wondering why even vaccinate kids at all.
Right. And I have had a lot of parents to ask me, why should we vaccinate our children 5 to 11 when typically children fare better if they contract coronavirus? There's a smaller percentage of children losing their lives and getting sick. But what I share with my parents is it's so important that we vaccinate the 5 to 11-year-old children once it's determined that the vaccines are safe and effective, which is happening right now with the FDA and the CDC. But there are three main reasons. The first reason is when children contract coronavirus, if they've not been vaccinated, there's a higher probability that they will contract coronavirus. Now they can serve as carriers, meaning that if they contract coronavirus, they can take it home and their parents, or if they have grandparents that live with them, they can pass it on to them. And the parents or the grandparents might be immunocompromised. Maybe they have chronic medical conditions such as diabetes, asthma, or even cancer on chemotherapy, which makes them very vulnerable and they can lose their lives. Number two, you also have to look at the fact that children can have interruptions, and children have had a lot of interruptions in their education. And it's so important right now for children 5 to 11 during these educational years that they do not miss school for so many reasons. And by having the ability to vaccinate the children 5 to 11, there's less of a chance that they'll contract coronavirus, and then there's less of a chance they'll have interruptions in their education, which is so important. And then the third reason is children have a very difficult time employing and maintaining the mitigative measures as far as protecting themselves from coronavirus, especially in the event that they're not vaccinated. And this includes wearing masks and social distancing. And I've had a lot of cases where parents would send their children to school with a mask on. For instance, one mom, she was so upset because her child went to school wearing a Superman mask and came home with a Batman mask on because he traded masks with his friends and traded all the respiratory droplets of his mask to his respiratory system, putting him at risk. So the opportunity for children to get vaccinated between the ages of 5 and 11 is going to be just phenomenal as far as helping us medical providers in this healthcare war that we're fighting against coronavirus.
Fantastic. Thank you so much, Dr. Quinn.